Breastfeeding shouldn't be painful at all. If there is pain, it means something's definitely wrong. Mums can have transient nipple soreness in the first few days, but it's very mild and it's tolerable. But anything more than that, we have to take a look at the latch. So there are a few common culprits. When you want to look at what is causing the pain, we generally look at when the pain comes on. So some mothers have pain during latching on or latching off the baby. And that's typically because the baby is maybe not positioned well at the breast, and when the baby comes to latch on, instead of latching on with a wide open mouth, they slurp the nipple in. So that can cause a lot of pain, especially when latching on. But these babies sometimes tend to manage to find a good latch even after latching, so the rest of the feed may not be painful. But again, when the mother latches the baby off, instead of doing it the right way, she may be just pulling the baby off the breast while the baby is still sucking. So that can actually cause damage to the nipple. And then over a period of time, of course, when you do this, each time you latch 8 times a day, it's going to end up being painful in a day or so. So one thing is the latch. Sometimes we find that the latch on is painful and it continues to pain throughout the duration of the breastfeed. Definitely could be because of a shallow latch. So the baby is not managed to deepen his latch on his own, is very shallow, just latched onto the tip of the nipple. Now what would happen in this case is the nipple gets pinched between the tongue and the hard palate, and it could pain for the entire duration of the feed. So we ask mums to take the baby off and relatch. Okay, once we've corrected the latch, hopefully, even with cracks, in spite of, any damage that has already been done to the nipple, we usually find dramatic improvement. Typically, if the latch is shallow, at the end of the feed, you would see a nipple that looks distorted. So either like a brand new lipstick, one side is just flattened out, or it could look really pinched, and we call it a stripe that goes across the tip of the nipple. Now, some mothers have pain after they've finished breastfeeding. So in between two breastfeeds. Typically they say it's a burning pain, it's could even be itchy sometimes. They're not tolerant to even their clothes brushing against the nipple. There are two things that could cause this. One is what we call Raynaud's. So because of compression during the feed, it may not hurt because the blood supply to the nipple is cut off. But after they finish the feed, as the blood returns back to the nipple, there is some amount of heat, and that could be perceived as burning. And this is called Raynaud's. It's actually quite painful. So again, correcting the latch really helps. In some cases, it could just be thrush, which is a yeast infection on the nipple. We find that mothers who've taken a recent dose of antibiotics can come up with burning pain like this. Typically, a yeast infection could set in much later. So she's enjoyed a good breastfeeding period and now is coming back with this pain and discomfort. So just correcting the latch in these cases is not going to help. A latch could also be painful if the baby has a problem with the anatomy, the structural anatomy of the mouth. So it could be sometimes that we've corrected the latch, we've tried everything, but the mother still has a lot of pain with breastfeeding. In these cases, it's almost always maybe a tongue tie or a lip tie, or it could be because of a very high palate. The roof of the mouth is really very concave, and in these cases, you would see continued discomfort.
For more exclusive parenting content, visit www.ParentCircle.com, your one-stop shop for everything parenting.